Time now for another edition of Sports Insider. I'm here with Russ Baumert, physical therapist with Faith Regional Rehabilitation Therapies. And today we're talking about the difference between a dislocated shoulder and a separated shoulder. So Russ, what can you tell us about the difference between the two?
The two are commonly confused, but a dislocation and a separation are two different injuries. A dislocation is an injury where the ball of your shoulder is forced out of the socket. It's usually due to a fall on an outstretched arm or a direct blow to the shoulder. A separation is an injury to the ligaments that connect the collarbone to the shoulder blade. It's usually associated with a fall directly onto the side of the shoulder. There are varying degrees of injuries to a separation because it's a ligament injury. It can be a mild sprain or a complete disruption.
So what are the common symptoms of each injury?
Both injuries commonly have pain, swelling, bruising, and an inability to move the arm. A dislocation will have a visible deformity in either the front or the back. A separation will have pain directly on top of the shoulder, with or without a deformity, depending on the severity of the injury.
So then how are each of these injuries treated?
Well, a dislocation requires immediate medical attention, with their doctor relocating the bone back into the socket. Treatment then usually includes immobilization, and then rehabilitation. Sometimes, if we have chronic dislocations, it can lead to surgeries. Treating separation will vary greatly because the injury can vary so greatly. It can be as short as a week off with some rest, or it could require surgery as well if the ligament is that compromised. Again, if the ligament's compromised and there's surgery, there's usually physical therapy to follow.
Great. Well, great information there. Thank you so much for joining me, Russ Baumert. And that's another edition of Sports Insider, brought to you by Faith Regional Health Services. At News Channel Nebraska, I'm Eric McKay.